The topic I've chosen is borderline personality disorder. What is borderline personality disorder? It's often misdiagnosed with bipolar, post-traumatic stress, and attachment disorders. That's because BPD can be a web of mental illnesses. Before we get into that, let's discuss the web of comorbidities. In 1989, Kreisman and Strauss illustrated the web of comorbidities in their book, I Love You, I Hate You, Don't Leave Me. So in figure 2-1, the schematic of position of BPD in relation to other mental disorders. So each mental illness here is in the web of borderline personality disorder. And this is important because eventually doctors have officially emphasized that there are 256 variations of specific diagnoses for borderline personality disorder, meaning that a person can have borderline personality disorder with anxiety, dissociation, and somatic disorder. In addition, they can also be histrionic, psychotic. They can also be hypochondriacs, obsessive compulsive, substance abuse, impulsive, and all of the other various criteria that come with these mental illnesses. They can also have attention deficit disorder. They can also have borderline personality disorder with the comorbidity of autism. BPD is really not a one-size-fits-all. Borderline personality disorder is one of the most complex mental illnesses, and it's considered a personality disorder because, unlike other mental illnesses, in addition to symptoms, there are also characteristics and traits which can result in approximately 256 variations of these specific diagnoses. Some of the BPD symptoms are frantic efforts to avoid real or imagined abandonment, a pattern of unstable, intense interpersonal relationships going from extremes, identity disturbances, impulsivity, recurrent suicidal behavior, affective instability due to marked reactivity of mood, chronic feelings of emptiness, inappropriate or intense anger, difficulty controlling anger, frequent displays of temper, transient stress-related paranoid ideation, or severe dissociative symptoms. So what is the criteria? So the abandonment fear can be real or imagined, and they can also have unstable relationships, meaning that their relationships can be on and off. Maybe it's something similar to a relationship like Amy Winehouse, who was a celebrity that we can see as a celebrity. She went from someone who was singing actively and very healthy with a little bit of sass, and then eventually she began taking illicit drugs, and then she became dependent on illicit drugs, and then that sort of created the impulse and the emptiness, and eventually led to the alleged suicide. And we can also see in other celebrities that their unstable and intense relationships are on and off. So we see a celebrity with their spouse, and then we see them with another celebrity, and then we see them with another celebrity, and it's like so many different boyfriends, girlfriends, and spouses that it's difficult to keep up. Identity disturbances, like in the personality, can shift. Impulsive behaviors like sex addiction, substance abuse, and dependency. Suicidal or self-injurious behavior, so they could have non-suicidal self-injury or suicidal self-injury, and they can also have suicidal ideation, which does not involve self-injury. They can also have emotional instability or affective instability, which is often diagnosed as emotional dysregulation. Often it can be like BPD with bipolar. Um, Emptiness, often feeling dread or avoid these feelings, can often be somatic experiences. So the individual can experience these like actual pain, um, or actual dread. So it's very physiological. Um, as for anger, they're easily irritated. They're like a boiling kettle waiting for someone to get burned, waiting to burst out in fury. They can also have psychotic like perpetual distortion, similar to psychosis or mania, being out of touch with reality, psychoaffective, they're high and low with their mood, and at the same time feeling like God and then hating themselves. The difference, however, is that unlike in bipolar disorder, which lasts for months, for BPD, it lasts weeks or days. So, according to Dr. Gunderson, every person has a personality, long-standing ways of perceiving, relating to, and thinking about the environment and oneself. However, when these traits are inflexible, maladaptive, and cause significant functional impairment or subjective stress, they constitute a personality disorder. Common traits with criteria. So, in addition to that criteria, the borderline traits are usefully subdivided into 4 factors, each of which represents an underlying temperament, aka phenotype, according to Dr. Gunderson. So, interpersonal hypersensitivity typically aligns with 1, 2, and 7. Affective emotional dysregulation aligns with criteria 6, 8, and 7. Behavioral dyscontrol or impulsivity with criteria 4 and 5. And disturbed sense of self, criteria 3 and 9. The reality about BPD, according to the National Coalition for Mental Wellbeing's partnership program with the Australian organization Mental Health First Aid, a person with schizophrenia is more likely to be institutionalized in a psychiatric hospital, just as much as a person with borderline personality disorder. If they're not well, if they're constantly going through crisis, if they're constantly dysregulated. However, when this person decides to attempt suicide, unfortunately, more people with BPD compared to schizophrenia pass away due to suicide. Biological considerations. Is BPD genetic? Yes, BPD is genetic. In addition to behavioral theories of child rearing, there are also genetic predispositions in which children are an estimated 50 to 70% most likely, just like bipolar disorder and suicidal ideation. They're very likely, there's a 50 to 70% chance that if a mother has BPD, she's going to pass it on to her child or a father. Environmental factors. Dr. Marshall Linehan and her colleague Dr. Kerr have adapted a theory that an invalidating and distressing environment can cause disturbance in a person with BPD. They can feel very dysregulated, very angry, very frustrated, throwing outbursts, impulsive, etc. So DBT therapy, which is what Dr. Marshall Linehan invented, with her colleagues, of course, with their help. So what she had found is that there are ways to translate therapeutically the needs of a person with BPD to their loved ones and to clinicians. And there are different types of DBT skills. And it's also one of the treatment options. BPD is treatable. There are treatment options available. The highly recommended and most efficient treatment to achieve long-term remission are DBT, family connections training for families, which is offered by the National Education Alliance for Borderline Personality Disorder. There are also peer support groups that are totally free at the National Alliance for Mental Illness. And also, very recently, there was a discovery at the Indian Psychology Institute that mindfulness based meditation and yoga. And there are also different types, more specific yogas that help with the symptoms of BPD. So recovery is possible, and thanks for sticking around. These are my references. Thank you.